There are changes and delays to an important report from the state on drownings. New tonight, I'm taking a look at how these changes affect the safety of our kids.
This is the sound of a child drowning.
Children can drown quickly and silently.
Messaging around water safety is strategic. It's based on trends in what's happening just before the water emergency.
We need the data so that we can address the trends and provide that information out to the public.
That info is compiled into an annual report from the health department, but we found it hasn't been updated in 2 years.
All three reports color the picture for us.
Lori Stauffer from the Drowning Coalition explains how the information was compiled from 3 places: hospital discharge records, death certificates, and firefighters on the scene.
The information that DHS was pulling from before was a lot from the fire departments, but they found that that can be a little bit sporadic. The thing that the Drowning Prevention Coalition likes about that firefighter data is it gives us a more clear picture of what happened on scene. Were they in street clothes or in a swimsuit? What was the barrier in place if there was? What was the caregiver doing in those scenarios? And that really doesn't come from the hospital data as clear as that report.
Instead of firefighter data, epidemiologists with the state now only use hospital discharge records. And the person who produced these reports has retired. We asked the department several times if they've hired someone for that position. They won't say. What's more, the position of director for the state health department is open too. That position, nominated by the governor. We reached out to Governor Hobbs's office to see if they have any plans to address the vacancy. They also did not give us an answer by our deadline. Meantime, the health department told us there are no plans to produce in-depth reporting on drownings, and it's a concern for drowning prevention experts.
Throughout the years, we have, as a coalition, wondered what would happen if DHS no longer put the report together for us. And we know that it is important to draw that line for us, and we would have to hire an epidemiologist to take a look at that ourselves. And we know that we would be willing to do that and call in fundraising, whatever we needed to in order to get that report, because it does make a difference in our community to have the data so that we can help save lives.
So in the last report they did do, it was noted that this report was not only essential, but actually should be expanded in the future. State epidemiologists at that time advised they would like to have the resources for a longer assessment of what happens to the whole family unit after a water emergency. So that would be everything from the functional outcome of the patient themselves to the educational success of the surviving siblings. They wanted this because they had no record of this being done anywhere else in the country. But now, Christine, we're moving from wanting the report to expand to not getting it at all, or very much at this point in limbo.
And we really need that streamlined report, right? So we can better understand, tragically, how often these drownings happen because of the warm weather in our state.
And specifically what's happening before. The barriers in place, were they not? Who was supposed to be watching them? She talked about street clothes in that story. That's important because it shows intent of the kid. If they were in their jammies, they had no intent of being around the water. So that data is critical in helping us understand what's going on.
Thank you, Katie.